the next system that we want all of you to start to put into effect, if you haven't done so already, or many times we say in these types of settings, how many people have written job descriptions? So by a show of hands, how many people have written job descriptions? Okay. Most of the time, when we review those, when we go into an individual office, they're very outdated. They were written at a time maybe when there are different people in the department now, or the roles have changed. So if you have them, that's great. We encourage you to review them. For everyone else, we would like to make this an action plan item where you go back, and the way that this project works is every person in the practice writes down what they think they're responsible for every day. So some things you do once a day or twice a day or many times a day, some things you only do once a week or once a month. I'm talking about everything. Like if you're the person who turns the lights on, that needs to be on your list, because remember, if a group of you were to win the Mega Millions and you decide not to come back, the people who take over on Monday morning need to know where the light switches are. So you have to tell them everything. And then once that list is created, you're going to review it with the doctor and as a group, because you're going to find very interestingly that many people may think they're responsible for the same thing, and there may be obvious tasks that are not listed on anyone's job description. So you go over it, you work out the kinks, and you decide, you make people responsible and accountable for the appropriate things. That then is going to become your procedure manual, and you're going to develop that, and we'll talk more about how to make that happen. But it should be, the job descriptions also eliminate the gray areas and make it so that some of those issues like who takes the garbage out or who left the spoons in the sink, stuff like that, which then become negative culture issues, those gray areas are eliminated when everyone has a clear understanding of what's expected of them. The next thing that we want you guys to do is to start having team meetings. Team meetings should not be held when the poo-poo's hitting the fan. They should be held regularly. Organized team meeting time will, without a doubt, be the most productive time of the month, doctors, because I know there's usually a lot of pushback that we can't afford to give up that amount of patient time. Organized team meetings and team meetings that are run the right way will, without a doubt, be the most productive time that you spend that month. They cannot be gripe sessions. They're not to talk about what we did last night or what we did over the weekend. It's business. They are run off of a business agenda. There's an example of a team meeting agenda in your handout. They should not be at the end of the day when people are tired and they have family responsibilities and people want to go home. It should be at the start of the day, ideally, or sometimes at a lunch if you promise not to violate it and run through it. People should take turns rotating leadership. It does not necessarily need to be the doctor that runs the team meeting. We definitely encourage you to bring in education. Have Chris from Straumann come in one day for lunch. Have one of your dental sales reps come in one day for lunch. And incorporating facilitators, as Dr. Katz mentioned earlier, having someone like a psychologist or a practice management coach come in for team meetings is another great enhanced item.
Well, we're just mentioning that there are agendas in your handout. There are some scripts that we're going to be addressing and referring to. We have a couple of manuals that are available at no charge, and if you would like a copy of either our scripts and verbal skills manual, or we have a collection of articles that we've written for our e-newsletter. If either of those things would be of interest to you, write it down on the question form that's on the left side of your packet, and we will email them to you.
So we also encourage daily huddles, equally as important as the formal team meetings. They should begin 10 minutes before the day is scheduled to begin. Everyone must attend, everyone must be prepared. This is probably one of the hardest things to get going in a practice. In fact, we have a couple of client offices now where we just have not been able to get it off the ground. There's always resistance. People say they can't get there on time, or the doctor comes in late, which is one of the key issues that we're having in some of our practices.
One office, what we've done is the doctor doesn't seem to be able to get there in time for the huddle, yet he expects his entire team there. So we have said that the lights do not go on in the office until the doctor has stood in and paid attention during it. Because when he showed up for the huddle, he's usually paying attention to something else. So he has to be attentive in the huddle, and no patient will be taken to a treatment room or the lights turned on in the treatment room until he has stood there. And we've seen in this office a reception room full of patients waiting there, and nobody does anything until he shows up. And finally, we're starting to get some breakthrough.
That's another perfect example of leading by example. If you desire for your team to be punctual, and you desire for your patients to be punctual, you will get back what you put out. So if anyone here in this room has a reputation for being chronically tardy, you're going to get that back in some way. So just know that, and know that if you are the leader in your practice, you do need to lead by example. So the Huddle agenda is also in the packet, and just to run through quickly, it should always start with a doctor's acknowledgement, as should the team meeting. And I want to talk to you a little bit about what acknowledgements are, because this is another great exercise that you can all begin doing. It goes back to the please and thank you and respect and gratitude. An acknowledgement is a specific example of something that someone on the team did that was special or extraordinary. And the very important thing to know about acknowledgements is after you have said the thing that was great, you must stop there. So you cannot, this is an example of an acknowledgement that would not be acceptable. You cannot say, Susan, I appreciate that you were able to fill up the morning schedule, but I really wish that you could have collected the money from Mr. Jones. That doesn't work. You need to stop at, I appreciate that you were able to fill the morning schedule. Talking about the desire to have collected money from another patient, that removes the feeling of gratitude and a specific example of appreciation. So that's the way an acknowledgement works. So also, we encourage you all to start doing acknowledgements at the beginning of every meeting. And then you should end with the thought for the day, which again should be positive. So can everyone read this up here? I don't know if it's too small for all of you to read. I don't want to read it.
It's in your handout as well.
It's in your handout. And when we talk about block scheduling, there's also something on the Huddle agenda. Let's say, for example, all of your reserved emergency time for that day was filled. So you don't have any more openings in that day. That's fantastic. However, the phone still may ring with an emergency. So a key item on here is to talk about the emergency time. At the morning huddle, doctor should decide where he or she would like the emergency put in the day's schedule should one call or two. That way there is no interruption of another patient in the chair. Also, we want to, in the morning, decide which patients will each of us ask for referrals. And we can highlight that on our day sheets. Each person on the team needs to take personal responsibility for asking for referrals throughout the day, regularly. And asking for referrals is never begging or seeming desperate. It should always come from a place of pride and a place of sincerity, and it should be something that we do passionately and that we do because we want to share the experience that we give to our patients with other people. And that's why we ask for referrals.